we need to speak about this particular topic especially is that we know that dementia is an illness which happens to a lot of people. We know that dementia is not something which will get treated by the medications. With medications, what we can maximum do is we can probably delay the progress of dementia. But definitely there are certain ways with which we can either avoid getting dementia altogether, or at least even if we're getting it, shouldn't be as severe. So, which is why we need to know what are the risk factors. Why does dementia happen? How do we become prone to it? And how can we prevent them? How can we prevent those risk factors? So this is what I will be covering today, which I then personally feel that it's a highly important topic. So at any point, if anybody has a doubt or any question, please stop me then and there, or you can, raise your hands and ask the question, and I'll be very happy to answer it. So I will not be talking in detail about what are the symptoms of dementia and how it happens and all of that, assuming that that has been already covered. I will cover only the specific aspects of it. First of all, why do we even need to know about dementia? Only reason is it's extremely high prevalent. All over the world, there are almost 55 million people who have dementia. And every year, newer and newer people, almost 10 million people every year are being diagnosed with dementia, which is, I think, a very high number. Second is, why does it happen? Most common form, I think most of us know, is Alzheimer's dementia. It happens because of a lot of reasons, which we will be seeing in the subsequent slides. Is it really important? It's an illness, let it happen. Why do we need to know about it? Yes, it's very important because it's the seventh leading cause of death. Dementia is the seventh leading cause of death in an elderly person, and a very important cause of disability and dependency also across the world. Again, another thing is it's a pretty expensive illness to have. So somebody who has dementia, their family members, this data I have taken from US, so I don't have the Indian data as such, but I think we can make an estimate that globally, America spends almost $1.3 trillion on dementia in every way, be it its health, be it's giving money to the people who are taking care of them, be it medications for their investigations, everything. So it's a very expensive illness to have. And thirdly, who are more likely to have it? That again, we will see in the subsequent slides. So I think by this much information, we have understood that dementia is a fairly important illness to first understand that why it happens and what else we can do about it. So this, I think we all already know, so I won't go into too much details of this, but the first, just like a quick recap. What all happens in dementia? People start having memory difficulties. They may start having difficulties in doing their regular tasks, their familiar task. They may have difficulty in language. They may get disoriented to wherever they are, to the time, to place, to persons. They may not be able to do the things, the complex activities. They may not take decisions, or they may have difficulty in judgment, etc. They may have problems in keeping track of things, how they used to do earlier, like in order, this will happen now, then I will do, this is the time I will pay my bills, this is the time I'll pay my rent, etc. That they may not be able to give. They may not be able to do comfortably. They may start misplacing things. There may be changes in their mood, their behaviors. They may have challenges in their visual and spatial information. So while they are driving, they may not understand how much distance to stop from the front car, when to stop, how much they have to turn, how much they have to turn if they're to take a turn on the right or left. And they may also withdraw from their work or some social activities. So these are some warning signs of dementia, which we need to be aware of. Now, a lot of people I have heard saying that forgetfulness is a normal part of aging. Some forgetfulness, some benign forgetfulness, yes, it may be a part of aging. But dementia is not a natural part of aging. It's an illness. It's a set of symptoms when our brain starts getting damaged by illness. And there are certain factors which makes a person more prone to getting dementia, which are known as a risk factors. So let us first understand what is risk and what is a risk factor. A person's risk of developing dementia is the chance that they will get dementia at some point in their life, be it at a little early age or maybe at a later age. So they might get a chance that they will have dementia. Some people have a little higher chance as compared to others. They are known as the people at higher risk. Risk factor is when something is known to increase a person's chance of developing conditions. So, for example, as we age, the chances of developing dementia increases. Of course, dementia is not seen in a younger population, seen in an older population. Likewise, there are other many more factors. So it's important that person may still get dementia if we avoid all the risk factors. They will just become low at risk, not completely no risk. So low at risk just makes a person less likely to get dementia. Does not mean that they will completely avoid dementia. So risk factor is basically something which increases the person's chances of developing a particular illness. As per the Alzheimer's organization, and as per the Lancet, as per basically the best research across the world, there are 14 risk factors which are there seen in dementia. For the ease of it, I will be dividing them in two factors, two ways: modifiable and non-modifiable. Non-modifiable is something which we really can't do anything about at right now. Right now, we can't do anything about it. But if, yeah, modifiable are which we can do something about it. We can we can bring some change in these factors so that our chances of getting dementia sort of comes down. So non-modifiable factors, basically the factors which are not really in our hands, we can't do anything about it, our age, our gender, our genes. If my mom has, I will have. I might have. The chances of me having dementia will sort of increase. Ethnicity, reduced education and cognitive reserve I've put here because we can't do much about it at a later age. But if at younger age only we know about it, maybe we can do something. If we know that lesser education can cause dementia later on, maybe at a very young age we can make sure that our children, etc., everybody is studied. But right now we can't do anything. Modifiable factors are things like smoking, alcohol, being overweight, not doing enough physical activities, high cholesterol, hypertension, diabetes, having head injuries, depression, not being able to see and not being able to hear, being isolated, and air pollution. So these are various modifiable and non-modifiable risk factors we will be talking about in the subsequent slides. And simultaneously, with the factors itself, I will also talk about how can we prevent them. Okay, so non-modifiable means we really can't do anything. We can't stop ourselves from aging, but we will try to see how we can maneuver around it. So the biggest risk factor for dementia is aging. There are certain statistics which are, which have been studying that if somebody is from 65 to 69, every two people in 100, every 2 in 100 people might get dementia. But if somebody is say above 90, 33 people in 100 may have dementia. So basically, as we age, the chances of us getting dementia increases. Why does it happen? Because as we age, there are a lot of changes which happen in us. There are psychological changes, there are physical changes, there are social changes. Physical changes like our ability to see, our ability to hear, that comes down. Our muscles become weak, our bone becomes weak. We start having a lot of physical complaints like hypertension, diabetes, etc. There are psychological changes that we are not naturally as fast as we used to be. We become cognitively a little slow. There might be some personality changes in us. Social changes, like our life basically our life changes. So usually, like I'll give an example. Say somebody is our usual retirement age is 60 years of age. I'm so sorry. Yeah. Our regular retirement age is around 60 years of age. So till 60 years, we were the main bread earner of the family. We were the ones who would take care of the house, we would get money, and because of us, our family would eat, etc. Very important people. Immediately after 60 years, we don't have anything to do. So our life changes, our social life changes. We stay more at home. We don't have money coming into us. We are not the breadwinners of the family. Socially, we start witnessing more deaths. There are death of family members, a death of friends. Then there might be some people who may have to change their residence. Say they would be used of living in a village, but then they, because of their children or somebody, they have to move to cities. So there are a lot of social changes also which happen as we age. Now, all of these changes may contribute in some way or the other in our cognitive decline or dementia. Next, this thing is gender. Now, actually, it is studied that both men and women have equal chances of getting dementia, but women who are above 80, they may have slightly higher risk. Why does that happen? Because certain hormones like estrogen, progesterone, etc., they kind of start coming down, which is why, I'm so sorry, which is why person who has women after the age of 80 years may have higher chances of developing dementia. Then genetics. Now, there are certain genetics. By that, I basically mean that if there is a family history of dementia, the chances of their offsprings, the chances of their family members also kind of increases. So, for example, say my mom, say if she had dementia, the chances of me having dementia also increases. Now, there are two types of familial genes. We don't need to know in detail about it. There is familial genes and risk genes. Familial genes are that if that particular gene is passed on by the parent to the child, that person will almost definitely have dementia. Other risk gene is ApoE gene. You would have heard something about it. This person has ApoE gene. Certain version of ApoE genes basically make you more prone to having dementia. By this particular slide, I basically mean to say that if there is somebody in my family who has dementia, the chances of me having dementia also increases. Then also there are certain studies which are done that Black Africans, South Asian, like basically us, Black Caribbean people, we might get dementia a little more than the white ethnic groups. Okay. Some reasons for this is that us like Black Africans, Black Caribbean, South Asian people, we may be at a higher risk to develop diabetes, cardiovascular problems, which can further cause dementia. We will see in subsequent slides. But then again, we can't do anything about our ethnicity. We are South Asians, we will be Southeast Asians only. This is where we can start bringing some change in our lives. First is less education. Low levels of education, especially in their early lives, they affect the cognitive reserves. Now, what is a cognitive reserve? We will see in the other slide. The point to be taken from that is that we should prioritize childhood education for everybody. What is a cognitive reserve? Now, cognitive reserve is basically the person's ability to fight a disease in their brain. So, if the cognitive reserve is higher or a larger cognitive reserve, the onset of dementia symptoms may be later. So, if I have cognitive reserve now, if I have a bigger cognitive reserve, larger cognitive reserve, then the chances of me having dementia, if I would have had dementia at the age of 60 years, if my cognitive reserve is high, I will probably get dementia at the age of 70 years. So cognitive reserve is basically the ability of the brain to fight an illness. There are 3-4 factors which lead to a smaller cognitive reserve, or the cognitive reserve is dependent on these. First is if people leave education early, or if people are not educated enough, or if their jobs are not as complicated, they don't have to use a lot of brain, their jobs are just very relaxed, very simple jobs, or if they are socially isolated. So what should we do? Now, the cognitive reserve start developing from the time we are children, from the time we are small. So as a child or as we are growing in our lives, first of all, extreme, like very high priority to giving education, which is should be ideally by the government, that education should be mandatory for every child. So education is very important. Working, having an occupation is really important. Homemaker is also an occupation, so I'm not going to exclude. I'm not going to say homemaking or somebody is a housewife has not worked. No, homemaking is also an occupation. Just make sure that you're working, you're doing some complex activities throughout your life, and you are highly active socially throughout your life. Along with that, at this age, when we become 60 and we can't really do anything to the cognitive reserve which we already have, challenge your brain. At this age, be a lifelong learner. Challenge your brain. Keep doing some different activities throughout your day. Do some new task or familiar task in a new way. So, for example, you're used to brushing your hair from your right hand. Try brushing your hair from the left hand. Okay. Or if you're used to brushing your teeth from your right hand, start brushing from your left hand. Start taking up new hobbies. Now, I'm not saying the hobbies which you're not interested in, but maybe some hobbies which you wanted to do, but you never got time, you never got a chance, but now you can do, you have time. So maybe learning how to sing some classical music or some Carnatic music, or if the health allows, maybe some simple dance forms. Like my mother these days, she's interested in learning folk dance of the place where she resides. So maybe learning a new dance forms if the health allows. Some people have started heading towards some physical fitness things like going for marathons, listening to music, learning a new language. Learning a new language is extremely stimulating your brain. Learning how to play a musical instrument or joining a choir, playing games like word puzzles, jigsaw, some memory games. There's a lot of apps also which are there in the phone these days, some brain memory apps. Playing games on that, that is perfectly all right. So the point is the brain should be active. Another modifiable factor is smoking. Now, basically, if you smoke too much, it causes some difficulty or some problems in your heart, lung, and blood circulation. Basically, it shortens the blood vessels. It makes the blood vessels very small. If enough blood is not going to your brain, the chances of having stroke or the chances of having other illnesses in the brain because of blood are quite high. So, smoking basically harms the blood vessels of the body. Recommendation is completely avoid smoking. Okay, completely avoid smoking. How can we do that? Speaking to a healthcare professional. So, there are a lot of nicotine replacement therapies which can help you in stopping smoking, or joining you with other resources in the community, setting a quit date that yes, this is the date I want to stop smoking completely. So slowly, maybe you can work towards it. See how to manage these withdrawal symptoms. Like, of course, when you are habituated to smoking and suddenly if you leave smoking, there'll be withdrawal symptoms. You'll be restless, you'll be very irritated, angry. How to prepare for these symptoms? What can be done to avoid this? Asking for help. Now, there are so many helplines across the country. Government of India, the toll-free number for Government of India is what I have put up here, 1800 112 356. It's a toll-free number. You can call them anytime, take help on how to reduce. Now, I completely understand that if we have smoked for so many years of our lives, suddenly stopping it is really difficult. So, if at all it's not possible to completely stop smoking, at least try to reduce it, what we call as a harm reduction. Reduce it to as minimum as possible. So, say if you're habituated to smoking one full packet of cigarette, which is 10 cigarettes per day, maybe try to reduce it to 2 or 3 cigarettes per day. Okay, which is known as basically harm reduction. Whatever harm would have happened when you were smoking, how you used to smoke, that can probably come down a little bit. Next is excessive alcohol use. Now, I know a lot of people believe, and I've also read in a lot of newspaper, that maybe one peg is okay or some wine is good for your heart and all of that. Um, I don't know how right or wrong it is, but the recommended amount of alcohol per week is around 14 units. And 14 units also you should not drink throughout, like in one sitting. Again, in this, the key is have harm reduction. Drink as less as possible, only for like the feel of it. If somebody drinks alcohol for a very long period of time, there are other lot of issues which can happen. It can affect the heart, it can affect the brain in a lot of negative ways, which can increase the risk of dementia. So, if at all somebody has to drink alcohol, it has to be very limited, say around 14 units of alcohol, which is, say, how do I say, I think I think 6 units is 30 ml. So this should be around 120 ml or something. So maybe 1/4 of alcohol in the whole week, not even in one setting. Okay. So in one whole week, maybe uh, small pegs in the whole week are kind of acceptable. Then is physical inactivity. Now, physical inactivity can affect almost the whole of our body, heart, lung, blood circulation, brain, everything. It is related to causing stroke, diabetes, heart diseases, etc. So, physical activity has an indirect role in causing dementia. Not directly, but an indirect way of causing dementia. So, what is recommended? Um, the recommendation is, this is by the WHO, so this is very important. First is aim for 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity each week, which basically, essentially, how we want to simply understand this is that walk for about 30 minutes, 30 to 40 minutes every day, and it should be a brisk walk. Okay, the recommendation is ideally this. We have to focus on these. The adults and the older adults one. Yeah, here. Adults and the older adults one. At least we should be exercising 4 to 5 times per week. Brisk walking would be wonderful. Along with that, we should also focus on exercises with which we can improve our balance and some amount of strength. Okay. But please remember not to overdo it, not to exercise too much. No, it should not be like I have to exercise more than some 300 minutes per week or something. Avoid that completely. If at all there is lesser mobility, if there are certain people who are not able to walk around too much, or who may have some back problems, or who may have some nerve issues, etc. They may not be able to walk too much. If at all there is lesser mobility, engage in activities which can, one, improve the balance so that we don't fall. So balance maintaining activities would be helpful, like doing yoga or some Tai Chi classes or breathing exercises and so on. Next is obesity. Now, again, it's connected with physical activity only. Obesity, physical activity, they again increase chances of somebody developing diabetes and hypertension. And somebody who's obese in their middle life, say if I become obese right now, the chances of me developing dementia also sort of increases. So how do we avoid it? Of course, by doing regular exercises and eating a healthy food. How does healthy, what do I know, what do I mean by healthy food? Healthy food is something really important, and I think all of us should keep a track of it. First is eating a Mediterranean style diet, which basically means have more fruits, more vegetables, more proteins in the form of pulses, cereals, and moderate amount of fish and dairy. Fish is good for people who eat non-veg. Fish is good. It has essential fatty acids, etc., but not too much, not to overdo that. Dairy and fish should be moderate in amount. So this Mediterranean diet also has shown to reduce the risk of dementia. And this is the diet which we also follow when somebody has hypertension. That is why it's called a DASH diet, or even when somebody has diabetes. So this kind of diet is higher in green leafy vegetables, nuts, pulses, legumes, fish, olive oil, etc. Second, when you're eating, look at your plate. It shouldn't be only carbs. It shouldn't be like the white is too much, you're eating too much rice. It should be limited. You should have a lot of colors. So there should be a mix of your salad, your a little bit of rice, little bit of dal, little bit of vegetable, whatever you want to eat. Throughout the day, have multiple servings of fruits and vegetables, not just once or twice, just multiple servings of vegetables. Um, Choose food which have lesser added sugar, lesser saturated fat, lesser salt. Eat high fiber diet. More breads which are higher in fiber, cereals, grains, boneless chicken breast, oatmeals, etc. Have food which are rich in omega-3 oils like cod liver oil or cold water fish, walnuts, etc. Then drink a lot of water throughout the day, preferably 3 to 4 liters of water throughout the day. And another key thing is less is more. So basically, when you're eating, don't eat too much in one go. Have some 4 or 5 meals throughout the day and eat little. Some every 2 3 hours, you can have little food, which can keep you active also, and which will not make you feel hungry. You'll feel like adequately full. So this is a very important diet which we all need to already start following. And if we know somebody who has dementia or a risk of dementia, we can always suggest this to them. Then there are cardiovascular risk factors, which basically means people have high cholesterol, high BP, or if they have diabetes. Why is it important? Because these cardiovascular illnesses, they can cause damage to the heart or the blood circulation. The Life's Simple Seven group, they define these health factors which can lead to basically a healthy heart is maintaining your BMI, don't be overweight, having a good diet, no smoking, having a good physical activity, controlled blood sugar, controlled cholesterol, and controlled glucose concentrations. Okay, so if we cover all of this, our heart's health will be nice, and heart and brain is always connected. So this is known as Simple Seven group, which are talking about the health factors of cardiovascular illness. So how can you reduce?
You just come back again on that because it's a very, very important point. All the 7 points once again.
Yeah.
Please. So that emphasize that.
Yeah, so the 7 very important points which this particular group suggest, which is meant to maintain the health of our heart, are having low BMI. Low BMI, I mean normal BMI, not low, not underweight, but normal BMI, which is usually from 18 to 23. So low, a normal BMI, having a healthy diet, Mediterranean or healthy diet, not smoking, doing good physical activity, keeping your BP at a normal level, maintaining your cholesterol levels, and maintaining your glucose concentrations.
Thank you, doctor.
Yes. Next is, so say somebody has hypertension, how can we lower it? How can we lower it? So this thing is, just give me 1 second. I think my battery is dying.
No problem. Take your time, doctor. Take your time. Absolutely no problem.
I'm really sorry for that. Actually, I think laptop battery is going away, so I just wanted my charger. Yeah. So how can we lower our blood pressure? Research shows that physical activity and healthy diet can automatically lead to a lower BP level and reduce the risk. If the lifestyle changes don't happen, then medicines will help. So if our doctors say that we have to take a hypertension medication, take it the way they ask you to do. Have less sodium and less salt intake, which basically means avoid pickle, avoid a lot of masala. Follow a diet which is lower in fat, and monitor the BP on a more regular basis. Monitor the BP on a more regular basis. And I know it's easy to say than actually doing it, but try to manage your stress. Have a lesser stressful life. Be more engaged in physical activities. Listen to more of music, right? Next is diabetes. How can we control diabetes to prevent dementia? First of all, regular monitoring of our glucose level, maintaining a healthy weight, talking to a dietitian that what kind of food we should eat so that our sugar levels don't go up, regular checkups of our sugar, and talking to our doctors regularly, and taking the medications as it is prescribed by the doctors themselves. Okay. Next is cholesterol. Now, cholesterols don't get confused. There are 2 kinds of cholesterol. Some cholesterols are good cholesterol, some cholesterol are bad cholesterols. So, LDL, if at all you see your blood report sometimes, LDL or low density lipoprotein is called as a bad cholesterol. So which basically means if it's too much, that means you are unhealthy. And there is a good cholesterol, which is HDL. You don't need to know this in detail, but just sometimes some people with some half of knowledge might try to confuse you. So for that purpose, remember LDL is the bad cholesterol. So the lesser is the bad cholesterol levels, the better it is. So how do we avoid that? Processed food, first of all, should be as less as possible. Now, I know we anyway don't eat a lot of cake and pizza and all of that, but still, despite that, also, I think Indians have a habit of eating other processed snacks. We eat a lot of namkeen. We eat a lot of other fried snacks like Morocco or something like that. So processed foods should be avoided as much as possible. Cook and eat majority of the food at home. So you're going to be able to control also what kind of food you should eat and how much you should eat. And if at all you still don't understand how to go about with food, then speak to a dietitian. They can give us information based on how much we need and what is the nutritional value on whatever we are already eating. Naveen sir has also suggested that can practicing yoga and pranayam avoid dementia. We will talk about it, sir. We will definitely talk about it next. Okay. Next is traumatic brain injury. So till now we have covered all the hypertension, diabetes, cholesterol, heart-related problems. All of this we have covered till now. Next come our traumatic brain injury. Traumatic brain injury is basically when there is a sudden blow or a jolt to the head and the person becomes unconscious. Now it can start. Now, if at all there is an injury in the brain, that can lead to Alzheimer's, so that can lead to dementia. Uh, Not everybody, now please understand that anybody who falls and just bangs their head somewhere, they may not get dementia. That is not head injury. Head injury is more severe. So head injury is when we should be careful when somebody has a road traffic accident or when somebody is in some army or some defense kind of work, when there is a high chance of them getting into injuring their brain. And some sports like boxing or horse riding or skiing, etc., the chances of them falling is high and them getting brain injury is more. So I'm talking about the serious traumatic brain injuries. So how do we prevent it? First of all, while driving and even while doing any sports activity like skating or biking, always wear a helmet. Hmm? Even if we are old or we are young, drive safely, wear a seat belt, wear a helmet. Review the medications very regularly to avoid the so here the point is that we have to avoid falls. So keep checking with your medications with the doctor and see that your medications should not make you fall. If at all there are a lot of stairs, etc., around you, make sure that there are some handles or some bars which you can hold. Or if at all there are chances of somebody slipping in the bathroom, make sure that there are some holding handrails or grab bars in the bathroom which you can hold and then get up. If you're taking a shower, there should be some adhesive mats from which you don't slip and you fall. If at all there are chances of falling, on the corners of the wall there should be those it's there on Amazon, which can which are not as sharp, and if you put like a sponge there, then there is no head injury or anything. So traumatic brain injury should be avoided at a younger age and at a later age also. Next is depression. Now, depression has harmful long-term effects on the brain. It makes, basically what happens in depression is that our brains kind of start working. So that is why they have higher risk of developing dementia at a later date. That is first thing. Second, sometimes depression may also get confused, or it may be called as a prodrome of dementia. So a prodrome of dementia means that when for some people the initial symptom may not be forgetfulness, but it may be dementia. So it has long term harmful effects on the brain, on how the person thinks, cope with difficulties, and all of that. So the treatment for this is early diagnosis and treatment, and being aware of it, knowing about it, that yes, depression may eventually even lead to dementia. So, what do we do? If at all we are feeling sad or tired or hopeless or irritable, there may be depression. So, we have to be first aware that there may be chances of depression. If at all there is a chance, consult your doctor or a mental health professional, seek treatment. Know about depression, know that depression can lead to dementia eventually. Maintain an active lifestyle, going on daily walks, speaking to a lot of people. Uh, Try to maintain a diary, like a journal, where you can write the feelings, what you're thinking, what are your experiences. Write it down in a journal. Sometimes we don't get a way to vent out what we are feeling. So that journal can be our venting way, that yes, this is what we are feeling and we are taking it out. Talking to your friends and family about how you're feeling, and sticking to the treatment plan. If the doctor prescribes that you have to take these medications, to take those medications. Speak to your doctor that if you're feeling any changes in the mood or behavior. Next is hearing loss and vision impairment. The broad thing about it is then when there is a sensory deficit means there are five senses we have, right? Uh, Being able to see, hearing, smelling, tasting, and touch. Now, of these, hearing and vision becomes really important. If there is any impairment in any of the sensations, the chances of us developing dementia is higher. Why is that? Because when we are, say, not able to hear anything, our brain is not becoming active. When we are not able to see something, the vision part of the brain is not being active. It's becoming dull. If the brain is not active, the chances of dementia becomes high. Along with that, there are other things. People who are not able to hear, they may withdraw themselves from the social situations, which is why their cognitive reserve will come down, which we saw in the beginning. Uh, if at all, if say I am not able to hear properly, so I will keep focusing on wanting to hear properly. Okay, I'm not able to hear, I'll keep focusing on wanting to hear properly, which is when I will not focus on other activities of the brain. Other mental processes of the brain will not happen. Okay, then of course there are other illnesses also which can affect the hearing. So hearing and vision are extremely important, predominantly for keeping the brain active. And this I will tell you from a very recent experience I have with one of my patients. He had a significant hearing loss. He was not able to hear anything. And his son brought him with the fact that he's forgetting. He does not remember anything. He misplaces things. He doesn't do any of his activities, etc. Then we suggested them to put a hearing aid. After a lot of difficulty, they understood, they put the hearing aid. After putting the hearing aid, when we did assessments on him, he was actually not having that bad dementia. His dementia was on the milder side. It's just that he didn't have to make effort in doing any other cognitive activity because hearing was happening on its own. So hearing and vision are of utmost importance. So what should we do? Have annual hearing evaluations. If at all there is a wax built up there, get it cleaned regularly by the doctor. Don't use that Q-tip to remove the wax. Get it removed by the doctor on a regular basis. If at all the doctor has given a hearing aid, make sure to use it. I completely understand and I know that putting a hearing aid is very difficult, but then putting a hearing aid can actually change your life. So, I mean, not your life, but somebody who has a hearing difficulty, putting a hearing aid can actually change their lives completely. For visions, go for a regular annual checkup. It's very, very important to go for regular annual checkups. Uh, in old age, not being able to see properly, the near vision, if you're not able to read properly, so presbyopia, that is a very common thing. Cataract is very common. Glaucoma is very common. So get evaluated for that at a regular basis, and whatever corrections are suggested, please go for that. Next is social isolations. The more connected we are with the world, the more connected socially we are, the chances of developing dementia is lesser. Why? Because social contact enhances cognitive reserve and beneficial behavior. I'll give an example how. The way I'm talking to you all here, or say, for example, the way I will speak to my mother, the way I will speak to my friend, and the way I'll speak to my patient are very different. Is it or not? It is going to be very different. How do I know that I have to make sure that all these behaviors are different? it's my brain which is telling me this. I cannot talk to my friend the way I'm talking to my patient, or I cannot talk to my friend the way I'm talking to my grandfather's friend. Of course, it's my brain which is telling me that there are different kinds of people and I have to speak to everybody in a different way. So, which means that my brain is active enough to understand the difference between these three people. Hence, the social contact increases your cognitive reserve. Our brain is active enough to understand that with different people, we have to behave and have to speak in a different way. And along with that, it will also reduce stress. It will also reduce inflammation. Some studies have shown that social isolation was linked to lowering gray matter volume. So in our brain, there are basically just understand that with social isolation meaning if we are not talking to a lot of people, if we are more isolated, the size of our brain basically start reducing. The volume of the brain starts reducing. So we have to avoid that and be as socially active as possible. Yeah. Yes. So how do we do that? How do we prevent ourselves from being socially isolated? Stay connected. That is the ground rule. Stay connected, join a service club, volunteering, meet more people. Or if new people you don't want to admit, you don't want to meet, then maybe visit old friends. Make regular phone calls with your relatives, with your friends, or use some social media, whatever we are comfortable with, be it phone or WhatsApp or Facebook, to be connected with all the friends and family, if at all there is a difficulty in using computer, etc. The last thing here is air pollution. Now, air pollution is again something not directly in our hands, but we have to understand that even air pollution can cause the risk of dementia. There are certain particles in traffic fumes or the chimney fumes which are there in the house, or some burning wood, etc., which can cause some particle deposition in the brain and in the blood vessels, because of which the brain becomes slow. Which is why the air pollution is also now current these days called as one of the risk factors of causing dementia. I'm not sure what we can do from our side, except maybe driving an electronic vehicle, maybe. Uh, but what has to be done from is basically from the policymakers and from the government, like banning heat fuels, or making the electric vehicles more and more mandatory, and so on. So finally, the steps to have a healthy brain is keep active, do not smoke, cut down your alcohol, look after your mental health, protect your head from any kind of injury, take care of your hearing, look after your eyes, manage your cholesterol levels, manage your diabetes, be socially connected, stay sharp, like keep your brain active, and manage your blood pressure. So these are the final take-home points for all of us. Along with that, like Sir told, I'm so sorry. Yeah. Like Sir told, I would like to tell a little bit about the project where I'm working as an assistant professor. The project is called as the India ENIGMA project. Now, this is a project which is funded by the US. By a university in America. They have funded this project, and it is actually running across the world. There are many centers across the world. And in this, what we are trying to see is the brain age gap. So we have three cohorts in this. We have healthy people, we have people who have mild cognitive impairment, like very less cognitive impairment, and people who have mild dementia. And in these three people, we take their blood, we do some blood investigations, we do MRI, and we do some cognitive tests and see how they are functioning in all these activities. And then we compare with each other. With this, what we get to know is what are the so say for example, I have a mild cognitive impairment and my friend has is a healthy person. They will assess me completely, how my life is, how my family is, what all I'm doing currently, what all I've done in the past, how is my brain on MRI, how does my blood say, and they will do it for my friend also. Then they compare what are the problems in me and what are the changes in them, what has caused dementia in me and what has caused no dementia in that person. Like, why does that person not have dementia? So with this, we will get to know again what are the various risk factors in addition to what we have already done, what are the various risk factors which can cause dementia, how to avoid them, and what could be the potential treatment for this. So in this, the kind of, so what we do with the volunteers who agree to become a part of this is, we tell them their blood investigations, their MRI, their entire cognitive test, everything is for free for them. So that's a benefit for them. And how is it beneficial for us? It's beneficial for us in a way that we are doing it for science. It's beneficial for the research. So with that information, we will have an idea that what are the risk factors and how can we prevent it. So if any one of you are volunteering to be a part of the project for science, basically, it would be wonderful. We do it at NIMHANS. We are sitting on the OPD days in G13 OPD. And if at all anybody is willing to be a part of, either as a healthy control or even if you have some memory deficits, small memory deficits, we would be very happy to recruit you in the project, and we will personally take care of you till you follow up for at least next 2 years. So this is all from my side right now. And if there are any questions, I would be very happy to take.
Thank you, doctor. That explains beautifully. You have very consciously and beautifully managed the whole time, as well as dementia. I think what are all the risk factors available for dementia and how to control them. You have beautifully explained. I think our senior friends who are very much interested in knowing this, they will be fully satisfied about that. And you have also given enough information about the ENIGMA project. So that ENIGMA project, I think anybody who wants to join, they are welcome. They can visit G31 in NIMHANS, Geriatrics block. Then they can enroll themselves as volunteers for that. All kinds of people are taken as volunteers there. There is no age restriction as far as I know. Isn't it?
Yes, sir. Absolutely. Absolutely, sir. So like I said, we have three populations. Three populations is healthy control, who have absolutely no problem. People who have some little minimal memory deficits, and people who have some amount of, like, good amount of memory deficits. So we are recruiting all of these participants. We are doing their detailed assessment, be it blood investigation, be it MRI. And MRI also is not a simple structural MRI. MRI is also, what you're doing is functional MRI, wherein we are trying to see not just the structure of the brain, but also how the brain is functioning. So functional MRI is what we are doing. And we are doing their blood investigations and seeing, is that actually causing them dementia or not. So it's a follow-up study. We do all these assessments today, and then we also see it after 2 years, that after 2 years, how are you the same person? Is your brain same? Is your blood investigation same? Are your cognitive activities same? That is what we are seeing. So in this, the requirement is that the participant has to be above 55 years. 55 years and above, anybody can be volunteer to become a part of this. And there should be no MRI contraindication. So whoever is interested.
That is the only problem, doctor, because above 55, most of us have done some RCT or other. And the replacement for this RCT, the crown is not, a very good crown. Because of the cost involved in porcelain crowns, we don't go in for that, and we are going for a lesser quality jazz. Therefore, that needs to be totally removed. That's one of the biggest problem, doctor. See, if you can address that issue, I think more and more people will join, because most of my friends who wanted to join this project, they could not, including myself. I could not join for the simple reason, because of the RCT. But RCT, again, at the time of taking the crown, my doctor said that this crown is okay. But here the MRI is for about an hour or so. Therefore, I went to a dentist. He said, sir, it's better to avoid it because it is contraindicated. So that is the only issue, doctor. I would request you to do something on that. I thought I will use this platform to request you to do that.
We did that, sir. So what changes we have made in that is, if somebody has a root canal treatment, say if there are some fillings, we get an opinion from our dentist. So we have collaborated with one of our dental surgeons, and he suggests if that particular implant is okay for an MRI or not. Earlier, what we used to do is, anybody who has a metal implant, we would just know. But now we have kind of collaborated with one of our dental friends, and he suggests us if we can get an MRI done for that person or not. Usually, if there are like one or two fillings in the lower jaw, then we are taking. For them, it's not a problem. But the ones who are contraindicated are if there are any plates, or if somebody has had a fracture and had a plate or any replacement there, them we of course can't take. Or if they also want to be a part from their orthopedicians, we need exactly what is the material of that implant which they have put, if it is compatible with our MRI. So that those two things we have started doing. In addition, but the thing is that ultimately we have to get an MRI. The picture should be clear. So if picture is not, yeah, stent and pacemakers also are not allowed, because stent and pacemakers are also iron. So the chances of somebody getting problem in the MRI machine are higher. So those people we are avoiding.
Yes, doctor. That helps, doctor. Then we will now go back to some of the questions in the chat box, doctor. See,
Sure, sir.
many have appreciated your presentation, doctor. It is only
Thank you.
natural that people need to appreciate you, because it was one of the best presentations I have come across in Vayomanasa Sanjeevani.
Thank you. Thank you so much.
Thank you. See, Dr. Nagaraj, Mr. Nagaraj Rao, who is a very good expert in this yoga, he has asked one question: how much vagus nerve is important to prevent dementia? Vagus nerve.
How much is it important in preventing dementia? So,
Yes,
sir,
sir.
vagus nerve, how we understand is it's an illness. It's a nerve which helps in controlling the parasympathetic and sympathetic nervous system of the body, right? But dementia, what happens at the brain level. So the sympathetic and parasympathetic happens at the body level. So basically understand below the neck level, that is where vagus nerve works. While dementia, what we are talking about is happening at this level, at the proper brain level. Now, vagus nerve cannot per se prevent dementia. Dementia is a degenerative illness which is happening here, not in the lower part of the body. Right. So when the dementia is happening here, when the brain, this is say the amount of brain we have, if the brain is becoming smaller in size, there is no nerve which can reverse it. The brain will get degenerated. It will happen invariably. However, there are certain studies which are still under studies. There are various RCTs, there are various studies which are undergoing. If we stimulate the vagus nerve, if there can be any improvement in some symptoms of dementia. But like I said, even if we do that, even if the vagus nerve gets stimulated and we, try to improve some symptoms of dementia, which is not studied till now, uh, it won't be long lasting. It'll just happen. Maybe there might be some one or two little bit improvement, but then it'll go back to the same state. Point being, dementia is a degenerative illness. The degeneration is happening here, and there is absolutely nothing which can prevent that degeneration.
So, there was not much of use in that.
Yes, I mean, vagus nerve is basically controlling the lower part of the brain, a lower part of the body.
Okay. Therefore, that's not much of it. And one more question I don't understand, that is, this is from Mr. Nehru Saab. He has asked one question that is, one second, I'll just go to that question. How and where to get the APOE Geni diagnosis, as my father is suffering from the age of 85 years.
Yeah.
He is now 95.
Yes. So, sir, that APOE gene testing that happens in a lot of place. I think APOE gene is something which we get after death. It's a postmortem. It's a postmortem gene which we get from the brain itself. So that usually, from what I know, it happens after the death. From as a part of our study, we are doing, as a part of our ENIGMA project, we are doing the genetic tests also. Whatever genes are available from the blood, and if at all they are related to dementia, we try to see that as well. Apart from that, there are certain, I think in NIMHANS also the genetic tests happen. I have to get back to you on that, how and what is the procedure to get it done. but there are certain places who do the detailed genetic tests also. And with that, we get to know if the ApoE gene is there or not.
One more question that has come is, can you please explain how obesity is affecting this dementia?
How what is affecting, sir? I didn't understand.
Obesity. Last question. Nice presentation. Thank you.
Obesity. Okay, okay. How obesity causes dementia, is it?
Yeah, yes. How
Right.
obesity?
Okay. Yeah.
Yes.
So obesity is multifactorial, sir. Obesity means the cholesterol levels are high. Obesity means the person is not physically active also. And obesity means that the blood vessels, they may have some depositions or the blood vessels become more and more tight. So the blood vessels become more tight when there is more deposition there. There is no enough blood going in the brain. That can cause vascular dementia is what we call. Now, dementia are of multiple types. There's Alzheimer's dementia, there is vascular dementia, there is frontotemporal dementia, and all of that. So, when dementia or forgetfulness happens because of some vascular presentation, vascular causes of cognitive decline, that is where the obesity and all the other things, hypertension, etc., they all come in picture.
Okay. Okay, doctor. Thank you, doctor. That explains.
Yeah.
Dr. Deva has also one more question.
Huh.
Another question, AADS.
Indication on dementia. So, what could you please expand AAADS? I don't know what that is.
Yeah, 1 second. I will just unmute him. Sir, you can unmute and talk, sir.
AADS is age activated attention deficit syndrome. Age active in Kannada is called Aralo Maralo.
Okay.
It's called age activated attention deficit syndrome. Normally happens, if you may try to keep the pen here and you'll be searching for the pen somewhere else on the table, something like that. Small indication. That is an indication for dementia. I have to explain about the other question also.
Yeah. I will stay on that.
Vagus nerve also I would like to discuss. Yeah.
Sure. So this AAADS, what you are saying, sir, that we actually consider as one of the symptoms of dementia, when the person is not able to concentrate on a particular activity, or if they have some recent memory deficits, like you said, they misplace things, they're not able to remember where they kept what, etc. These are a few symptoms which are suggestive of a cognitive decline in a person. Now, this particular cognitive decline could be either completely normal aging, or this could be something what we called as an MCI, which is mild cognitive impairment, or it could be somewhere heading towards dementia. If it's heading towards dementia, say mild dementia or moderate dementia, then we understand that it's a progressive illness. It might keep happening, like it might keep worsening. If it's somewhere in lines of MCI, mild cognitive impairment, there are 60 to 70% chances that it may stay as it is. It may not worsen to dementia, or it may not become normal also. It may just stay as it is. While sometimes even in normal aging, because as we are aging, our ability to concentrate, our ability to do multiple things at a time, basically the attention part, that automatically starts reducing. Because of that, we are not able to do multiple things at a time and we forget where we kept what, and our attention reduces. So that could be a part of the normal aging also. So if at all there are any such symptoms, it's always a good idea to get yourself evaluated, so that one, if at all it's treatable, it should be treatable, it should be treated. If it is not treatable, or if it's just like a benign thing, no harm, then there could be some cognitively stimulating activities which can be suggested to the participant.
Can I expand this other question, doctor, about the vagus nerve?
Yes, sir, please say.
Yeah, in the vagus nerve, you said it is responsible mostly for the body down, other than brain. But as I understand, it is the major cranial nerve communicating whatever happens in the body to the brain.
Yes.
So
Absolutely.
when that is such important thing, if properly it doesn't go to the brain, then the problem starts. That's why I asked that question of vagus nerve, out voice, but you said that it is more concerned with the lower part of the body,
Yeah.
not brain, but it's a communication between the brain and the body.
Definitely, definitely, sir. All the cranial nerves of our body, be it from eyes to our tongue, our swallowing abilities, vagus nerve, every part, every nerve has connection with the brain. The place from where the nerve originates, that locus lies in the brain itself. But like I said, okay, in that way, we can say that when the brain starts degenerating, these cranial nerves also starts getting affected, which is why when somebody has severe dementia, you would have seen extremely severe dementia. In them, they start having swallowing difficulties also. They may not be able to swallow directly. So we will understand that, okay, brain is happening here, degeneration is happening here. Why are we not able to swallow? Which is where your theory comes in. Ki most of our nerves have a root or the origin in the brain itself. So when the brain itself is degenerating, if that part of the brain which is responsible for origin of that cranial nerve, which is responsible for the work down the body, then that effect will start happening.
Thank you, doctor. Thank you.
Yes, sir. Okay, I think there was one point in the beginning by Naveen, sir, that can practicing yoga and pranayam avoid dementia? Sir, it's a very important point, and I'm sorry I didn't cover it in my presentation. Yoga and pranayam, I'm not sure if it can avoid dementia or not, but it can 100% help you improve your concentration. So this is what I also personally suggest to everybody who I know, my participants, even be it healthy, not healthy, everybody, that as we age, normally only our concentration starts reducing. With doing yoga, pranayam, and some meditation exercises with which we can improve our concentration, the chances of us developing dementia may sort of probably come down. Our brain becomes more active. We are able to concentrate better. Our attention improves, which again helps in avoiding dementia.
Can I add something here, doctor?
Yes, sir. Please, please.
Yeah. In fact, just breathing, one of the records that indicates that it changes the epigenetics of the brain, like mycelium in multiple sclerosis. It can be slightly avoided because the deep breathing strengthens the mycelium without getting dissolved or destroyed, something like that. That's why I thought that deep breathing would definitely be advantageous in keeping away the dementia or whatever it is.
Yes, sir. Absolutely, absolutely. Okay. Then other thing is RCT is root canal treatment. I think sir has already told. Other question. Yes, sir. So T. Shivkumar sir has told that if we are to associate in the project, how many days would require for assessments and how many visits? Thank you for bringing this question, sir. So we would require at least 2 days of assessment, wherein we have to fix in advance when would be an MRI date available, and we have to take blood on empty stomach, basically in the fasting state, and we would require some time for doing the clinical assessments. Clinical assessments usually take a little bit time, in the sense they are elaborate tests, takes about 3 to 4 hours. If you're completely healthy, then 2 to 3 hours, but if there is some decline or some this thing, then it may take a little longer time also. So we try telling all our participants that keep 2 days for these. Whenever you want to come, let us know. We will try to fix for an MRI slot. Keep 2 days for these so that we can, complete everything all together. Also, there is a second visit after this. So one would be, say you got evaluated today and tomorrow. Then after 2 years, there will be another follow-up, wherein we will again reassess the cognitive activity. We will reassess the MRI and we will redo the blood investigations. Everything is done again. It's a 2-year follow-up study. So if at all anybody wants to do, then have at least 2-3 days in hands to make it a comfortable enrollment. Otherwise, it becomes very tiring for participants at what I have seen. Please contact Geriatrics unit of NIMHANS in person. Yes, and you can contact me also directly. I would be happy to facilitate your involvement in the project. Meditation helps. Box teething may also be useful. Whom to inform? Whom to inform means, ma'am, Bhuvana ma'am, I didn't understand. I will give you number, I will put a number here. You all can note it down. And yeah, you all can note it down maybe. And just give them a call that you are interested in being this. They will do a very brief assessment.
You can put it in the I mean in the chat
Yes,
also, that number.
yes, sir. Yes, sir. 61 596 718.
896.
This is one number.
Can you just tell it once more, ma?
9611
9611
596
596
718.
718. One number.
This is
9611
one number.
718. Yes.
Yeah, the other number is 910 88 094
094
14.
14. I will repeat it. 91088 09414.
Yeah.
These numbers can be reached for joining this ENIGMA project. They may first raise give a short, small assessment, then they will take you in the project. Yeah, am I right, doctor?
Yes, sir. Absolutely,
That is
absolutely.
the procedure. That is the procedure. So, we need to value your time, doctor. I know, see, we have overshot by about 10, 15 minutes. 30 minutes to be done. Therefore, what I will now see, in fact, again and again, somebody has asked this, can you expand ENIGMA? ENIGMA.
Yeah. So, sir, ENIGMA is basically a consortium which is happening across the country. So, it is enhanced imaging and genetic meta-analysis.
Imaging and enhanced imaging and genetic metallic analysis.
Meta-analysis, yeah. So it's basically meta-analysis, yeah. So it's basically analysis which is happening across the world. And in this, we are trying to see of different populations. So Indians are one population, Americans will be one population, UK will be one population, and we will be comparing the data of all the different kinds of population.
Yes, doctor, thank you. If there are no other questions, I think it is time that we close down. And with your, I on behalf of all my, participants in the webinar and on my personal behalf, I thank you for an excellent presentation on this dreaded disease, dementia, because we know how dreaded it is and how people are worried about this dementia. And the percentage population, etc. When we are talking about the percentage, there is no point in that. We have to really know the number. The numbers are really huge, and we don't have today enough, enough medical facilities to take care of all of them. And once it has come, there is no cure at all. That is also one more problem.
Absolutely, absolutely.
Yeah. Therefore, it is very essential that we prevent it from coming. We prevent it. We avoid it. Therefore, whatever things you have, whatever ideas you have given, whatever research-based views that you have given, information that you have given, will be very useful to all of us, doctor. We will try to share this also, because as usual, this will be uploaded in our YouTube channel by tomorrow evening maximum. So therefore, people whoever wants to again revisit this program, they can also come back, because this is one of the best. I will rate it as one of the best programs that we have posted in this Vayomanasa Sanjeevani, doctor.
Can I add something, Jambunathan?
Yes, please, sir. Please, sir.
It's a wonderful experience of ours going through this 1 hour session, doctor. And I was one of the volunteers like Jambunathan, but I was not fit because I had undergone the TKR, total knee replacement. And the doctors, Dr. John and also PT suggested that we should not go through the MRI. That's why I was not in a position. I hope this is an excellent presentation, very helpful for the benefit of the people. Thank you.
I hope so. And a very sincere request for everybody to follow the things, because they're not very difficult. Whatever we spoke about today, they're not very difficult to follow. We just need to have a reason to follow all of this. And I think the biggest reason is we have to prevent dementia. We have to prevent ourselves from getting dementia. So
Mind.
just keeping our brain active is the key to not fall into the trap of dementia. So please do all these activities. They are fairly easy. It's not even asking you to take up a lot of time of yours. And if at all anybody is willing to be a part of the projects, please call the numbers which I have put up on the chat box. Please call us anytime and we would be very happy to facilitate your involvement. We require patience. I mean, it's basically for science. It's basically for science. So we would be very happy to have you in our project.
Thank you, Doctor. So I think many will be motivated after listening to you. I'm 100% sure that almost all will be motivated to join you for the project. And we'll also, motivate people further, Doctor. Thank you very much.
Thank you so much, sir. Thank you, everybody, for patient listening. I know it was a very odd time of the hour after lunch and everything. It might be a little sleepy also, but thank you for patiently listening to me, giving questions which are making me also think, in lines of what else I need to read more. So thank you all for such active participation.
Thank you very much, Doctor. And on our side, what is the percent that we can give you? We can only pray God to shower on you and your family. All
thank you, sir.
That is the only prayer that we can make. So that even in that we have got a one personal motive in the sense that you will continue to serve us.
Absolutely, sir. Anytime. I'm very happy to do this. It was the first time I have taken one session on Alzheimer's previously. This is the second session I'm taking, very long back, almost 2 years back. And this is the second session I'm taking. If any of you want me to take any session on any topic, I'll be very happy to do it. I'll prepare for it and I'll come to you all for my presentation.
Thank you, Doctor. We are eagerly noted down your point. I will talk to Dr. Vijay Kumar and try to involve you for more projects now.
Definitely.